We're taking you live to Melbourne now. We're listening to James Merlino giving today's COVID-19 update.
In term 4, and then we'll hear from our Deputy Cho, Deb Friedman, and then happy to answer any questions. So just before this press conference, I had a conversation with Andrew Crisp, our Emergency Management Commissioner, and there'll be further updates through the course of today, but I can advise an earthquake of the magnitude 5.8 occurred in Mansfield area this morning at approximately 9:15 a.m. This was recently revised from 6.0. The earthquake was 10 kilometres deep, and this was followed by 3 aftershocks, magnitude 5.5 at 9:40, 4.0 at 9:55 and 3.1 at 10:15. Geoscience have confirmed there is a possibility that we may receive further aftershocks and potential risk of further earthquakes. Indeed, more aftershocks could occur for weeks, if not months. Buildings have been damaged in the Mansfield township. No reports of injury at this stage. Beechworth Hospital lost power but have backup. Helicopters have been dispatched for aerial intelligence gathering. EMV has issued a statewide warning at watch and act level, and that's been issued, as I said, for the whole of Victoria. Building damage has been reported across Kensington, Ascot Vale, Parkdale, Prahran, Balwyn, Elstonwick, Northcote and West Melbourne. So 46 reports in total. Most are minor and no injuries reported. There was a spike of 35,000 customers off power this morning, but most are now back, and that's mostly in the northern metropolitan area. So they're being reconnected quickly. Triple O calls spiked around 9 a.m. this morning, but are returning to normal, and that's the same case with call-outs for SES. Spiked early today, but now back to normal levels. Incident control centres have been set up in Dandenong, Mansfield and Benalla. There's been some public transport impacts, including on the Traralgon and Seymour lines. And as I said, there'll be further updates through the course of the day from SES and our emergency services. But I was in the car, so I didn't feel anything, but Megan was at a community health centre getting our kids vaccinated with their first dose, and they felt it. So it was right across Melbourne and many parts of regional Victoria. This was quite a significant event and quite scary for a lot of people. So please take care, keep observing the EMV alerts and warnings that are being issued, and there'll be more to say later in the day. So in terms of COVID, there were 628 new cases yesterday, all locally acquired. That brings us to a total of 6,223 active cases. Sadly, 3 people have lost their lives. A woman in her 50s from Wyndham, a man in his 70s, also from Wyndham, and a man in his 80s from Darebin. And we pass on our deepest condolences to their family and their friends. 257 people are currently in hospital with COVID-19, 58 are in ICU and 37 are on ventilator. Of the cases who were in hospital yesterday, 81% were not vaccinated, 15% were partially vaccinated, and 3% of people were fully vaccinated. This number is a little higher today, as some fully vaccinated aged care residents have been transferred to hospital for observation. 60,829 tests were processed yesterday. 43,056 vaccines were administered at our state hubs yesterday, and we're now at 74.3% having received a first dose and 45% having received a second dose. In terms of Ballarat, I am pleased to announce that the City of Ballarat will end its 7-day lockdown at midnight tonight. The public health team feel that they have the outbreak contained, and thanks to the extraordinary efforts of Ballarat residents who came out in droves to get tested and who followed the lockdown rules. So my thanks to the entire community of Ballarat. The 5 reasons to leave your home will no longer apply, and the settings in Ballarat will align with the areas of regional Victoria not in lockdown. However, there are still important public health restrictions in place. Masks must still be worn indoors and outdoors. No one can come to your home to visit, and getting tested and vaccinated is just as important as ever. So I want to again pass on my thanks to Ballarat for doing the right thing and helping us chase down this outbreak. We must do what we can to help protect these areas. In addition, the Chief Health Officer has advised that at 11:59 p.m. tonight, those areas of Point Lonsdale located within the city of Greater Geelong will be able to follow the same rules that apply